after the live stream starts to really kick off today's session. Thank you.
Ara ko tāku manu e manu ti ori mai rā ki runga i toku maunga o ahu mairangi. Kia wakaronga atu rā ki ngā rau uia ki ngā rau kura i kara pene mai nei kei raro i te tā u o tēnei ware. Kei ngā rau rangatira mānau mai ara mai ki te kaupapa tangata i mu i te aroaro o tātou. Ki te here ngā tangata ki te kā ui ao o nāia nei rei. Hoi anō rā, huri atu ki a rātou kua whetūrangitia. Mai te hiku o te ika, mai te tai rāuti, mai te tai auauru, mai te waipaunamu. Rātau, i kā puni mai rā, kua hinga ngā turā ki tēnei ngā rara o te mate urutā, me ngā aito o te motu. Rātau te pō, huri atu ki a tātou i te awa watea. Kei ngā raurangatira mā, kei ngā māreikura, kei ngā whatukura. Tēnei te mihi. Tēnei te mihi rawa atu rā ki a koutou e kā puni mai nei ki roto i tēnei ko anga kōrero. I te pirimia, tēnā koe. Tēnā koe me tō whakarura hau kei ngā mema o te whare mata tēnā koutou katoa. Kei ngā ngai kahurangi, kei ngai tā, tēnei te mihi rawa atu rā, kei te tēpue e noho nei rā, i mui te aroaro o te mārea i tēnei ata. Hoi anō rā, tēnei te kaupapa. Tēnei te kaupapa ki te here ngā tangata o Aotearoa ki te kāhui au. Nō reira, whiua mai ngā pātai ki runga i te pakitara kōrero, waiho mā te tēpu nei i waka oti o ki atu rā o rātau wakaro ki a koutou. Kaore te kūmea roa, ko tēnei te raukura o te atiawa i whakatau nei ki a koutou, kei roto i tō tātou piringa whare, tēnā koutou, i runga i te kaupapa o te ata nei. Ara, tātou e tū tira mai ki te whai iau ki te ao mārama, mō tātou e herenga atu ki te kāhui au, tēnā koutou. Tū tira mai ngā iwi, tātou e. Tū tira mai ngā iwi, tātou e. Whai a te māramatanga, me te aroha e ngā iwi, kia tapatahi, kia kotahira, tātou e. Tātou e. Tēnā koutou e noho. In appropriate waiata, in the words of our Prime Minister, let's be kind to one another. And as a nation of 5 million, as a team of 5 million that came together in appropriate waiata, where we all came together to whai a te māramatanga to find a solution to protect our nation. Nō reira tēnā koutou, kia ora koutou katoa, kauri.
Kia ora kura, namihinui and tēnā koutou katoa. For those of you that's just joined on the live stream, my name's Juliet Gerrard and I'm the Prime Minister's Chief Science Advisor and also your MC for today. I'd now like to welcome to the stage the Honourable Dr Ayesha Verrall, Associate Minister of Health. As Associate Minister of Health, Ayesha plays a key role in our COVID-19 response and rollout of the vaccine and was also an infectious diseases doctor.
E ngā mana, e ngā reo, e ngā iwi, tēnā koutou katoa. Ka huri ki ngā mana whenua o te rohi nei, tēnā koutou. He mihi hoki ki a tātou ko tai mai nei I raro I te kaupapa o te rā. Nō reira, tēnā koutou katoa. Welcome to the Reconnecting New Zealanders to the World Forum here at the National Library. Today, we will be discussing some of the big questions facing us as we continue to protect New Zealanders against COVID-19, while at the same time preparing to gradually and safely reconnect with the world. But before I begin, can I start by acknowledging the Prime Minister, Jacinda Ardern, ministerial colleagues, including the Minister for COVID-19 Response, Chris Hipkins, and the members of the Strategic COVID-19 Public Health Advisory Group, including Chair, Professor Sir David Skegg, and all today's speakers. Yesterday, we released 3 pieces of advice from Sir David and the group on the future of our COVID-19 elimination strategy and the idea of a phased reopening of the borders. You'll hear directly from Sir David shortly about that work, but from my perspective, it has been incredibly valuable. I want to thank the group for its ongoing contribution and sharing their expertise. All the way through New Zealand's response to the global pandemic, the government has relied on expert scientific advice and public health advice, and that approach has proven its worth time and time again. We have sustained some of the world's lowest numbers of cases and deaths and enjoyed the fewest restrictions on everyday life. From our alert level system to our contact tracing system and managed isolation, we have used the best available evidence to keep New Zealanders safe, to protect our freedoms, and to protect our economy. I do want to reflect on that for a moment, and particularly the phrase, the best available evidence. Our response has never stood still. As the virus changes and new evidence emerges, we learn, adapt, and improve. Our managed isolation system, for example, has been continually strengthened. As we learnt about airborne transmission, we have altered ventilation systems and the personal protective equipment used by staff. As new variants emerged, we have responded to cases with short, sharp alert level changes and large-scale contact tracing, sometimes tracing more than 2,000 contacts per case. All those decisions were informed by the best available evidence. And of course, it is the science of vaccination that is front and centre in our response to COVID this year. Using mRNA technology, highly effective and safe vaccines have been developed. And New Zealand is one of only a handful of countries able to offer those to everyone. In the last week, more than 270,000 vaccinations have been delivered, and our rollout plan is on track. Completing the rollout and getting as many people as possible protected must remain our priority for this year. Vaccination protects individuals, whānau and communities, and as our vaccination rates rise, it presents us with fresh opportunities. High levels of vaccination will help avoid the need for lockdowns, and the more people that get vaccinated, the greater our possibilities for freer movement in the future. How to do that safely and with confidence is at the heart of today's discussion. I don't think it will surprise anyone here today that any changes to our border controls will be gradual and deliberate. Modelling by Te Puna Matatini, performed prior to the characterisation of the Delta variant, finds no realistic level of vaccine coverage above which the virus can't be transmitted in the community. However, there are certainly levels at which outbreaks become smaller and easier to control. Alongside high levels of vaccination, we will need to continue public health measures like large-scale testing and contact tracing for a long time to come. One last thought before I hand back to Dame Juliet Gerrard. Despite our successful response, the last year and a half has not been easy. We all want to know what lies ahead, when we can travel for work, family and fun like we used to. The difficult truth is that we can't provide absolute certainty. The situation reminds me of encounters I used to have with patients with life-threatening illnesses, who would naturally ask me what their future looked like. But being expert in their illness, I knew their path ahead was uncertain. There is a risk to providing false certainty and false hope. Disease is unpredictable, and doctors who make promises they can't keep end up undermining the trust of their patients, trust that is crucial to the success of ongoing treatment. This virus has mutated and evolved over the last year. As a government, we can't use yesterday's evidence to predict where we'll be in 6 months' time. but we can set out a framework for how we will respond to changing circumstances and how we will continue to use the best available evidence to inform our approach. One thing that will not change, however, is that our decisions will be driven by the same desire to keep New Zealanders safe that has characterised our response to COVID-19 throughout. Nō reira, tēnā koutou katoa.
Thank you, Dr Verrall. I'd now like to introduce Sir David Skegg. David is well known as an epidemiologist, public health physician, and chair of the Strategic COVID-19 Independent Public Health Advisory Group, a group of experts in epidemiology, infectious diseases, public health, and modelling who provide independent expert advice on our ongoing COVID-19 response. David will now present his much-awaited overview of the Strategic COVID-19 Public Health Advisory Group's advice on Reconnecting New Zealand. Welcome, David.
Tēnā koutou katoa. Thank you, Juliet, and thank you for everything you've done since the start of this pandemic. I'm sure you didn't envisage it when you took on the job. When Minister Verrall asked me to chair this advisory group, I quickly realised that any friends I had would be disappointed by whatever we said. Some people are impatient for the borders to be thrown open as soon as possible, while others would prefer that we maintain or even tighten current restrictions until there is no risk that we could end up in the same strife as so many other countries. I'm glad to have 5 excellent colleagues, Maya Brewerton, who will be on the panel this morning, Philip Hill, Ella Iosua, David Murdoch, and Nikki Turner, and most of them are here today. But fortunately, it's the politicians who have to make the difficult decisions. And the government will determine its plan. Our job is to give independent scientific advice, and we try to answer questions set by ministers, and on the web you'll find 3 letters about Reconnecting New Zealand. This will be an iterative process over the coming months. The pandemic crisis is still growing, and I think many people perhaps don't realise that. Globally, there are about 10,000 deaths being reported each day. That number is much higher than 12 months ago, and it's increasing. I don't need to tell you about all the personal tragedies and disruption that are still unfolding. New Zealand is widely held to have handled the pandemic better than any other nation so far. Now we face the next round. Whereas so many countries have faced a terrible burden of illness and premature deaths, we actually had a decline in mortality from all causes last year. According to the Oxford Stringency Index, we have been less affected by government restrictions, such as lockdowns, than other developed countries, including Sweden. But of course, there have been substantial costs, both social and economic, and these fall unevenly on different people. I feel sorry for young people who won't have the same freedoms and opportunities that many of us enjoyed, at least for the next few years. The world has changed, and some things will never be the same. In a sense, this is going to be a drawn-out war between the human race and a microbe. It may seem odd to describe a tiny virus as an enemy, but it is a formidable one. And despite remarkable scientific progress in developing highly effective and safe vaccines, globally, the virus is still winning the war. One of our problems is that our allies have let us down. Many countries that could have eliminated COVID-19 either never tried or threw in the towel. Each country has done its own thing. The independent channel chaired by former Prime Minister Helen Clark showed how a weakened World Health Organization has been unable to provide the leadership required. Another challenge is that the enemy keeps adapting. In recent months, several new variants of SARS-CoV-2 have emerged, making control far more difficult. The Delta variant, becoming dominant worldwide, is at least twice as infectious as the Wuhan virus and appears to be more liable to cause severe illness. I hear that Winston Churchill has been making headlines around here recently. Not just because he's an insult to the smoke-free policy. Near the beginning of the Second World War, can you imagine if Churchill had been expected to provide a detailed plan on how he was going to defeat the enemy? How could he have known that Hitler would turn his troops on the Russians, or that the Japanese would bomb Pearl Harbor and join the war? Nor can we pretend to have a detailed plan as to how we'll reconnect with the world over the next year or two. Clearly, our urgent priority is to get nearly all New Zealanders protected by vaccination. We expect that to be done, at least for adults, by the end of the year. By then, we could be facing a new variant that is even more challenging than Delta, and the global situation will certainly be very different. We'll know more about the immunity provided by vaccines. We'll have better tests. And we could even have effective antiviral treatment, antiviral drugs on the horizon, which might completely change our attitude to this virus. But of course, we do need a strategy defining our long-term goal and how we're aiming to achieve it. Tactics, the concrete steps we take along the way, will be modified in the light of experience. So the first question to our group was whether the elimination strategy will still be viable as international travel resumes. It's a pity that the term elimination, as used by epidemiologists, can be confusing. It does not mean eradication, nor does it necessarily mean zero COVID. Early in the pandemic, the Director General of Health confirmed that our elimination approach focuses on zero tolerance towards new cases rather than a goal of no new cases. Our group has followed this definition, which treats elimination as a process rather than a permanent outcome. Many people argued that elimination was impossible. Well, they were wrong. New Zealand did eliminate COVID-19, and so did several other countries, including China. There's no doubt that our elimination strategy has served us well. I often compare us with Scotland, another country with just over 5 million people. New Zealand has had a total of 26 deaths during the pandemic. Some of those actually travellers arriving in MIQ. Scotland has had over 10,000 deaths. And more Scots have suffered chronic illness, the so-called long COVID. We dodged a bullet, and our social and community life has flourished in comparison with countries where repeated lockdowns and restrictions on gatherings have made the past 16 months a time of frustration and grief. It's no surprise that the Economist Intelligence Unit ranked Auckland as first and Wellington as fourth in the world's most livable cities. They would have been second and fifth, but evidently Dunedin did not meet the population threshold. I'm sure of that. But what about the future? Can we maintain elimination as we reopen our borders, as we must do? High levels of vaccination should make it easier to stamp out clusters of COVID-19, but new variants like Delta will make it more difficult. If we have to give up on elimination and allow the virus to become endemic, many New Zealanders will end up in hospital and a sizable number will die, though a lot fewer than if we'd let the virus spread last year. So our group wrestled with the question. We concluded that at this stage of the pandemic, the elimination strategy is not only viable, but also the best option. It allows us to enjoy a lifestyle that is relatively unaffected by the ravages of COVID-19 and to protect our health service and our economy. The UK, after a disastrous year, has had a great vaccination rollout. And now 94% of English adults have antibodies arising from vaccination or past infection or both. Yet last week, they still had 627 deaths from COVID, the equivalent of about 48 deaths a week in our population. And most British people are avoiding contacts with others. Social contacts are down even on last summer, and they're barely a quarter of what they were before the pandemic. Many people are working at home, and about 90% are still wearing a mask outside the house. Look at this crowded room. I can't see anyone wearing a mask, and we're not fearful of contagion. This is a rare thing in the world today. It would be unthinkable in most countries. I hope not to spend the rest of my life shielding from others, especially each winter. And although masks are an important part of raised alert levels, I don't want to spend the rest of my life looking at beautiful faces covered by masks. But we are going for gold, and we may not succeed, especially if we don't achieve high vaccination coverage. So our group recommended that the elimination strategy should be reviewed regularly. So what needs to be done? The most important factor is to vaccinate as many people as possible and not to leave particular groups, such as Maori and Pacifica, unprotected. Next, we have to minimise the number of people bringing the virus into the country. In our papers, you'll see the precautions we're recommending to allow people from low and medium risk countries to enter New Zealand without quarantine or with a reduced MIQ requirement. They include proof of vaccination, pre-flight PCR testing, rapid testing on arrival, and special measures to assist contact tracing. Even with all these precautions, the virus will keep entering the country. The vaccines are very good at preventing severe illness and death, but they're not so reliable at preventing illness with mild or no symptoms. And with the Delta virus, vaccinated people with such breakthrough infections may be just as likely as unvaccinated cases to infect others. We must continue to bolster our public health response so that small clusters of infection will not turn into large outbreaks requiring lockdowns. Our group suggests that the contact tracing capacity of public health units needs to be reviewed and probably expanded. And the rest of us will need to lift our game. For example, we recommend that the scanning of QR codes should be mandated at some types of venue. There also needs to be a review of the capacity of our hospitals and health system for dealing with possible large outbreaks of COVID-19. When can we start? Well, our reports outline all the work that needs to be done in the next few months. We support the plan for a phased reopening of borders, and we recommend that this should begin when everyone has had a chance to be vaccinated at the beginning of next year. If we were to start before then, with only a partially vaccinated population, outbreaks of infection would probably require level 4 lockdowns to bring them under control. Look at what's happened in Sydney, where authorities are struggling to control an outbreak that may have started with one person, a limousine driver, who was infected by the aircrew that he was transporting. More than half of the Australian population has been in lockdown, and of course Sydney is now in its 7th week of lockdown. We propose that the process should start with fully vaccinated New Zealanders who are returning after a short trip away. If all goes to plan, restrictions on different categories of traveller will be lifted progressively during next year. You may have heard about the Australian government's national plan. This actually was not as definitive as many people imagined, and sadly it's been derailed by their current crisis. But the rigorous and realistic report that they commissioned from the Doherty Institute, and I would really commend that if people are interested, also makes it very clear that Australia will not be managing COVID-19 just like the flu. That is very clear from the Doherty report. Despite what some people still assume, I think, and Minister Verrall already mentioned this, vaccination will not achieve herd immunity. If that's understood as meaning that the infection will stop spreading through the population simply because enough people are immune. But there is a continuum, and the degree of community protection depends on the level of coverage that is achieved. Our group did not favour setting a specific target. We should be aiming to get as near as possible to 100% of eligible people vaccinated. That will enable New Zealand to reconnect with the world with the least disruption, illness and death toll from COVID-19. We all need to remember that getting the vaccine protects us as individuals, but it also protects our family, our whānau, our community and our way of life. Kia ora tātou.
Thank you, David. And we'll now begin our panel discussion. So if the panellists would like to join us on the stage. I'll introduce the panel as they take their seats. So we have Sir Brian Roche. Brian is the Group Chair of the COVID-19 Independent Continuous Review, Improvement and Advice Group, which provides independent advice on improvements to New Zealand's COVID-19 response. Brian brings extensive governance, leadership and business experience, having held senior leadership positions across the public and private sectors, but from my tie poll, I think he leans more towards the business sector. Ashley Bloomfield probably needs no introduction as New Zealand's Director General of Health and Chief Executive of the Ministry of Health. A public health physician by training, Ashley has led New Zealand's health response to COVID-19, and since his first press conference on the 27th of January 2020, he's been one of the leading public figures in New Zealand's response to the pandemic. Dr. Maya Brereton is a clinical immunologist and allergist at Auckland Hospital and former lead clinician. Maya heads the immunology laboratory at Waitemata DHB, and she has recently been appointed to the board of the Malagan Institute of Medical Research. Maya also is a member of the Strategic COVID-19 Independent Public Health Advisory Group. Mr. Rob Fye, leading the No Tie team, is the chair of the Business Leaders Forum that lends expertise and guidance to the government on New Zealand's economic recovery from the pandemic. Rob has extensive business experience, including as former CEO of Air New Zealand and former chairman and CEO of Icebreaker. And Dr. Api Talamatonga. Api is an Auckland-based GP, health leader and member of the COVID-19 Surveillance and Testing Strategy Group, which provides advice to government and oversees its surveillance and testing plans. Api also chairs the Pacifica GP network. And last but certainly not least, Professor Michael Baker. Michael is an epidemiologist at the University of Otago and has been one of New Zealand's go-to science experts since the start of the COVID-19 pandemic. Michael has also been one of New Zealand's most prolific researchers on COVID-19 and was the lead author of the world's first published COVID-19 elimination strategy. I'll shortly join the speakers on the stage, but just by way of some opening remarks, I think we've heard from David that we are planning our way out of what is a highly dynamic situation and in a situation of escalating risk. So as I went through the questions that have been sent in from the audience this week, a lot of them were essentially about two things. One was, what's the risk appetite of the country? And the others were, how can we mitigate those risks? So we got way more questions than we've got time for, but what I've tried to do is pull some questions around those themes. So the first question, maybe to Michael. Oh, and don't forget that you've got time to put your questions up on the Slido for when we finish the structured discussion. So to Michael, as we open the border, perhaps, as we've heard from David, letting in fully vaccinated people first, it's likely that we'll need additional public health and social measures in place to avoid needing to use lockdowns. I wonder, especially for the people at home on the live stream, if you could paint a picture of what that might look like for an individual going about their day. What sort of public health measures can we expect?
Yeah, well, tēnā koutou katoa. Thanks, Juliet, for that question. And first of all, I'd really like to congratulate Sir David and his group on their advice, and also to the government for putting science and evidence right at the centre of the response throughout. So in reply to this question, I think like all of you, I'm thinking about what will it be like being here, say, in a year's time in the ever-changing COVID environment. And on a good day, as Sir David has said, it will be very much like this. We'll be enjoying a similar levels of freedom. We'll all be highly vaccinated. We'll have mandatory scanning in for attending an event like this. Bluetooth will be activated on our phones. But on a bad day, that is if, despite our best efforts at stopping the virus at the border, we have an outbreak, what will that look like? And again, I think it will be broadly similar to now. People will be highly vaccinated, so the effects of infection, the risk of serious illness and death will be hugely reduced. By this stage, I think the evidence will have firmed up that COVID-19 is a serious infection in children as well as in adults in terms of long COVID effects. So we'll be vaccinating children as well. The wild card is we may have highly effective antivirals, which will make the consequence of illness much less severe than they are now. And we need that because, of course, our health system cannot cope with a massive outbreak, and we all know that. In terms of public health and social measures, I think these will continue to be refined. Contact tracing will be happening very rapidly. There will be refinements in terms of some of the electronic support. There will be a bigger range of testing options. We'll have citywide or even suburb-specific escalation of the alert level system. The system will be revised from what we have now. It will be more nuanced. An event like this, of course, would be happening virtually if we were in an outbreak situation. People will be supported to work from home in these circumstances. People who are attending work and school will be wearing masks indoors, and we may be also monitoring indoor air quality much more than we are now, because we know ventilation is so important with limiting transmission of respiratory viruses. Also, I think we'll be taking every opportunity, and I think an outbreak would be an opportunity to extend vaccine, that's opportunistic vaccination. We may also be starting to use booster vaccination for our more vulnerable groups. So with all of these measures, hopefully the outbreak would be eliminated rapidly, and also the consequences would be far less severe than with an outbreak now. Thanks.
Thank you, Michael. Turning now to Rob, we've heard that we're in a really highly ambiguous and uncertain situation. Could you maybe comment on how the business community can support the Reconnecting plan with the background of that environment?
Sure, and I think to open up, as a business person, I'm really encouraged again by the report of Sir David and the team. I think it gives a clear signal of the intent to open up. I think that's important. I was hoping just a month or two ago that some of those moves might happen pre-Christmas, but we've seen what's happened with Delta, and clearly across the Tasman, if we open too early before we have our defences in place, then before we know it, we'll be back in lockdown. That would be a disaster from a business perspective. We're talking about reconnecting, but actually, if I look through a business lens, the thing that destroys confidence and viability of businesses is lockdowns. And what is very clear to me that business needs to be doing is doing everything they can to support people to get vaccinated. You know, if you look at the tools available in the toolkit, we have the border, we have vaccines, we have contact tracing and so on. But actually lockdowns are the consequence if we don't get those other tools developed to the level they need to prevent the inevitable restriction on movement around our communities. So getting people and making people available to get vaccinated, creating an understanding within your workplace as to why people need to get vaccinated, but also getting the use of QR codes up, making sure people present for testing, anyone that's feeling sick or concerned about the state of their health. There's so much we can be doing within business to encourage and support the pursuit of our freedoms to go back to living our lives as close to what we were prior to the COVID pandemic arriving. Thank you.
Thanks, Rob. Turning to Brian, I think you've got the longest named committee about continuous improvement.
It's his fault.
So we've heard, we all agree we need to get vaccinated and we need to avoid lockdowns at all, do everything we possibly can to avoid them. What components do you think we need to add to our systems nationally to strengthen those layers of protections? And maybe use the ports as an example.
Yeah, thanks. Well, look, I think David's already sort of suggested that the phased reopening does expose us to certain risks. We have the time on our side before that decision is made to think about the future system. And when our group thinks about the system, we think very much around speed, agility and integration. We need to have a highly responsive, well-informed system that draws on the best international experience, the best scientific experience, to have us prepared as a nation and a plan able to be executed. We're lucky as a country that we actually have the really core foundations of that system already proven, it's already worked. We just need to sort of re-energise it, as it were, for this sort of unknown. And when I think about that in the terms of the border, there's no shortcut. That is just a non-negotiable that we have to continue to strengthen every access point into this country, whether it's an airport or a seaport. And although it's challenging, you know, we are on the way to doing it. And I just think if we let a gap in the system, we're exposing ourselves to a risk which is completely avoidable, and we just need to get on with it.
So actually, I think you've got the hardest question, which is a pool of very many of the questions that came in, which is when can we get on with things? So David said that we need to vaccinate a very high percentage of vulnerable groups and that we are going for gold. So let's assume we can do that and the team of 5 million gets vaccinated. Do you think we can eventually evolve our current elimination strategy to some more permissive management strategy? And how might new strains bobbing up or antivirals appearing change that? Can you paint a picture for us?
Thanks, Juliet, and kia ora koutou. So, actually, we are getting on with it, is what I would first say, and as David outlined, we are getting on with it to an extent that is way greater than many other countries and jurisdictions. Second thing I think is just to reflect again on what we mean by elimination. Actually, if elimination means we'll have zero tolerance for the virus in our communities, and that's an approach that has served us well to date, we want to keep open the option of maintaining that approach. And in a way, it's not a new approach. It's exactly the approach we have to other vaccine-preventable diseases. Measles, I think, is the best example, a more infectious virus than even the Delta variant of COVID-19. New Zealand has achieved elimination status of measles previously. We had an outbreak in 2019, particularly in South Auckland, and we took an elimination approach. That is, that we stamped out the virus from our community. So we took that zero tolerance approach. And there's no reason to think why that might not be the best approach to COVID-19 into the future. So it may well be, rather than sort of a less managed approach, that it will be a more managed and a continually learning approach. So again, just to go back, the important thing here is that we keep this option open, and the elimination approach has been fundamental to us maintaining all our options to date. And we should, as Sir David said, continually review it and see whether it needs to be, whether we need to adapt our response to make sure we maintain it for as long as possible.
And the new strains and the antivirals?
Well, Michael's touched on this. Actually, the arrival of a number of incredibly effective and very safe vaccines in such a short space of time shows just what can happen if government and the private sector and science come together with a sense of urgency. There is a similar effort going into antivirals, so they may well play a role. But again, we don't have effective antivirals against measles. It's just treatment of symptoms, which is currently the most important part of the response to people with COVID-19 infection. So antivirals may play a role. We've seen, for example, over the history of HIV infection that they have played an increasingly and now a fundamental role to improving and maintaining well-being for people living with HIV infection. So they may play a role, but in the meantime, we've got to just keep all our options open.
Thank you. And turning now to Maya, what can we learn from Māori communities' response to the pandemic that might support wider uptake across Aotearoa of the vaccine across all communities?
Kia ora, tēnei te uri o paraurangi, o kahunganu, e mihi ana ki a koutou. Kia ora. So I think for Māori in this, it has been very clear the response was rapid and agile, just as Brian supported that approach. And what it was it centred around whānau and community. So at the heart of being Māori is you put your community and your whānau ahead of yourself. And I think that was very much what happened around New Zealand. And I think it's important to recognise that that is not unique to Māori. Lots of people do that, and I think it is very important that what we do is led by our communities. And my concern around the vaccine rollout is that it was clear from the response of Māori that there is no one size that will fit all. And we have to be dynamic in this, and we have to meet our communities where they need to be met. And so as we move through this vaccine rollout, we need to look at who our vulnerable are, and Māori prioritise our vulnerable. It is not just our elderly, it is not just those with pre-existing conditions. I think that poverty and deprivation make people vulnerable. And we have a lot of marginalised people who get forgotten in these conversations. And we have a responsibility to them too. So I guess what we can learn is that we need to focus on those who aren't accessing our vaccine, and we need to change our vaccine rollout if need be to meet those people in the community and ask them what it is that we can do differently for them. Because nobody knows a community like that community, and nobody knows a whānau like that whānau. We have learnt that there may be this idea that people don't want the vaccine, but I would assume first and foremost that people want the vaccine, but they are not able to access it. And I want to be very clear that those are two different things. And so as we look at these numbers and we drive for 100%, and that is my aim, because every jab in an arm makes me happy as an immunologist, that we look to those groups, you know, and we need the support of New Zealanders to reach all of those groups. And I think we have shown that we care about each other. So that's what I'm hoping for, and backed by good science, I think we can get there, Juliet.
Kia ora.
Kia ora.
So Afi, following on from that, how can we minimise the barriers to vaccinating Pacific communities in Aotearoa so that we can be really confident that those barriers are low and everyone has had their opportunity before we start to think about opening the borders?
Bulavinaka, everyone, and thank you, Juliet. I think equity needs to continually drive our approach with vaccination. And I think about it as the 3 V's, sort of educating about the vaccine, the vaccination, actual vaccination is important, and the venue surrounding all of that. So if I can just briefly touch on what Maya said about the communities, don't assume, vaccine hesitancy is thrown around quite a lot. It's a new thing, it's changing, it's cunning, it's going to infect people. It's a bit worrying that we use the hesitancy as a blame sometimes. I think educating our communities is really important so that they appreciate this virus and how harmful it can be. And then we've got to vaccinate. As Maya said, take it to the community. In Pacifica, like Māori, we have the infrastructures there. We have the schools, we have the churches, we have general practices, Pacific providers who are not fly-by-nighters. They've been around 20, 30 years. They are trusted within our community, and they're the ones we should be using. Leads on to the venue. Just having a venue that is going to attract our Pacifica people to come along. Having it as a festival, I mean, the example in Porirua with Capital Coast, where in a day they vaccinated close to 1,000 people, but they did it like a festival. It was music, Pacific Kai, and yes, you get a vaccine as well when you turn up. So, I think there's a lot we can do and we need to be smarter. Vinaka.
Thank you. And finally, back to you, David, before we open up the discussion. It was really interesting reading the 3 letters. So it wasn't one report, it was a series of letters because you're responding to a dynamic situation to see how the thinking had evolved. Yeah. So the first letter is almost quite chipper. And the last one's a bit more sober. So would you like to reflect on how that evolving situation in Australia influenced the panel's thinking as you were working through the process?
Yes, and not just Australia, actually. I think we did mention Delta in the first letter, but the tone changed over quite a short time, really, just a matter of weeks, which just, again, shows what a dynamic pandemic we're in. But over that time, we've learnt a lot more about Delta, and the Australian experience certainly has been sobering. So say one case producing the disaster they have at the moment, because New South Wales was really admired for the quality of its contact tracing. They thought they were the best, and I don't know whether they were or not, but they were very good. And they had been always reluctant to go into lockdown. I think they made a very unfortunate decision to delay lockdown, and I actually quite often watch their 1 o'clock, it's 1 o'clock here, their press briefing. It's very interesting. And the Premier keeps saying, this is the most stringent lockdown, well, it's not actually compared with the lockdown we had, but ours was so short. But it's still not what we would regard as a level 4 lockdown. But now they've got about 350 cases a day. There are 60 or 70 people in ICU. I'd hate us to have to try and find spaces for that number of people in our ICUs. And I don't see their way out, actually. I don't know that the Premier is now talking about, well, if we can get the vaccination up to 50%, we might be able to reduce the restrictions, but that will just make things worse. So it's a very unfortunate situation, and of course, it's spilling over the border into other states. Obviously, it has implications for us. First of all, it's a warning to us that it could happen anywhere. I'm sure we would go into lockdown much more quickly. So I don't think we would end up with the New South Wales situation. But, we do have Delta here. People always say, if it comes, it's already in a couple of hospitals. It's an MIQ. So we've always got to be vigilant and not to be complacent. But also it's going to have implications, I think, for the bubble. I don't think anyone could be sure what's going to happen to that over the months ahead. And also, of course, if Australia really gives up on its elimination strategy, they never like to use that word, but they were doing it, and quite successfully, that's a pity for us too. And we may have to treat them as one of the low-risk countries like Singapore and the other countries that we would like to open up to quickly. But it's all too soon to say. But I think, you know, New Zealand's been fortunate to learn from the experiences of other countries. And China, of course, which, as I mentioned, had also eliminated COVID-19, and I hope they'll get back to that status, but they're dealing with a significant outbreak of Delta as well, although it's actually tiny compared with what Europe and places have. It's funny, whenever it happens in a country like New Zealand or Australia, if you look at The Guardian or the other English papers, they say, oh, there's this massive outbreak. Well, you know, it's tiny compared with what they're having. And China, of course, has got this fantastic capacity to, you know, test 9 million people in Wuhan or Nanjing in a short time. And I was on an international committee with some people from China. Apparently it's the private sector. They said, oh, those businesses are doing very well. That's not what I imagined would be the case. But, you know, we should continue to learn and obviously support our friends in Australia as much as we can.
Thank you. So anyone on the panel want to comment on any of the other comments, or should we rip into the Slido questions? There's plenty coming through. Any comments before we do that? Everyone's very well behaved. So they're being voted up, so I'll just take them in the order that they are on my screen rather than try and filter them. How significant of a risk are vaccine hesitant people from preventing us reaching herd immunity? Who'd like to take that one?
What about Michael? I've already had my say because we're not going to reach herd immunity.
No,
so,
Yes, that's right.
we can shall I deconstruct the question first, which is it's not one magic number but a continuum. So shall we change it to moving along the spectrum of herd immunity?
Yeah, well, I think, as we all know, the vaccine's highly effective at preventing serious illness and death. So there's a huge individual benefit from having it. And that on its own is a good justification. The question about transmission, you will be less infectious to the people around you, but the vaccine is not succeeding as well at that as we'd originally hoped. So it will help to dampen down transmission, but we know we can't vaccinate our way out of the pandemic. Unfortunately, the virus is just too infectious, but it will help. And obviously there's that huge individual benefit. And after all, we know our health system cannot cope with a huge number of people turning up in intensive care, and that will displace people with other conditions. Intensive care is operating at pretty much full capacity every winter anyway, so that means you're cancelling all the elective surgery and lots of other things. So there's a massive community benefit if everyone is vaccinated. I'm not sure if we even need to convince people in the room of this, but obviously some people still need to be convinced around New Zealand.
Clear message, I think. Everyone thinks we should get vaccinated on the panel.
Yeah, because the counterfactual, right, if we go through this vaccination program and get to the end of it and we only end up at, say, 40%, the reality is we'll be going into lockdowns all the time. I mean, in COVID, even if we keep the border closed, COVID's still going to get through the border, right? So the counterfactual looks far uglier, right, than any other scenario.
Ashley.
Thanks, Juliet. Just the question was predicated on the vaccine hesitancy being the barrier, and I just want to come back to the comments that Maya and Api made. Actually, I've never felt vaccine hesitancy is the problem, because we know that most people, if they have information from someone they trust and the vaccine is offered in a setting and by someone they trust, then they will take up that offer. So the challenge is really for us to make sure that we make the vaccine available to all those all eligible people in New Zealand, and I'm confident that if we do our job well, we will get very high rates of coverage.
Can I make one other comment?
Yep.
This was touched on by Michael. I was quite sort of sad yesterday. Quite a few people had commented in the media after our reports came out, saying, well, it's time we stop worrying about unvaccinated people. You know, if they don't want to get vaccinated, we're just going to have to go ahead. It's a bit like that line in the Bible, you know, am I my brother's keeper? But actually, it's not just a matter of being our brother's keeper. It's also a fact that if we have a lot of unvaccinated people becoming ill, our health service will be swamped. And as Michael said, people with cancer won't get treated. That's what's been a big problem in the UK. There's been huge delays in cancer treatment. If you have a heart attack or a stroke, you know, your care is going to be affected by the hospitals basically not coping. So I hope we can actually be unselfish and care about each other, but we also need to care about the whole. And I really hope, you know, New Zealand did so well last year. We had tremendous community spirit. We need to realise now we are in a new round, and I hope we can beat the world at vaccination as well. And that's what we've got to try and do.
That's a brave target. So,
Juliet, I
yeah,
just had a comment because I think they're not in this room, but there is a big proportion of New Zealanders who can't currently get vaccinated, our children and our teenagers. They're not vaccine hesitant, they just, at this stage, we don't have the evidence to say that we should necessarily be vaccinating them yet. And we have to remind ourselves by looking overseas at how disproportionately these young people have been affected by COVID and their education, and again disproportionately affected those who are the most deprived. You look at the UK data, the fall behind in their education, there is no doubt they are our future. I have 2 children myself. And sometimes we forget to have the conversation about our kids and our adolescents who currently are not sitting in this room, but they are our future. And so we are protecting them as well as we move through this. And we have to keep this elimination strategy, I believe, to protect them.
that takes us perfectly to the next most popular question, which I think is one for Ashley. Is there a plan to vaccinate 12 to 15-year-olds before the summer holidays, using schools as a platform to vaccinate?
Watch this space. What I would say is, of course, and it's been signalled, we have looked at and are looking at the evidence for 12 to 15s, and we are also looking at the evidence as it emerges from trials for younger children as well. So the trials have been undertaken in children as young as 6 months up, and this is a very big and vulnerable part of our population, and particularly if we think about our Māori and Pacifica populations, which have a younger age structure, then it's very important that we consider vaccinating them as soon as we have good evidence around efficacy and safety. And so we are watching that evidence like a hawk, and we are providing advice on that, so watch that space.
Might direct the next one at you, Rob, to start off. What does success look like over the next few years? I think lots of the questions we had prior are actually asking that question. So what are we shooting at?
Yeah, I mean, if I put a business hat on to answer that question, you know, businesses like certainty. We're clearly living in a world that's got an enormous amount of uncertainty. But what you need to plan is scenarios. And I think, for me, what's important as we look at success is we need a lot of transparency. I think it's really important between government and business. As evidence comes to light, we need to share that and allow people to plan based on the most up-to-date, most available knowledge. Situations will change. You know, chances are when we come to make decisions early next year about this progressive opening, it won't be Delta anymore. It'll probably be some variant we haven't even heard of yet. So we have to be agile. So success to me isn't a defined number or defined date. Success is us collectively between government and business being agile, being transparent, and being honest and open about the challenges that we're facing and how collectively we're going to overcome those challenges. So it's more about defining how we approach the journey rather than thinking of a destination.
And I guess a lot of the questions are framed around business, but there's also, once we open up travel, it's not just people who are travelling that are affected, it's also communities. So could we reflect on what success looks like in communities? Maya Api?
When I've been around the country talking to Pacifica communities about vaccination, we don't use the term herd immunity. We say community immunity. So it's a community that loves and protects each other, that socializes and mixes with each other, And so looking after each other like we did at the height of the pandemic response last year is really important. Getting tested because you don't want to take the virus home to Nana or Pops. You just wanted to be sure of that. So I think personally, the more the community understands it's a new vaccine, it's a new virus, but also understands their role in protecting not just themselves and their ainga, but also the wider community.
So we can still gather.
Yes, yeah.
So the next most popular question is very specific. I think it's for you, David. Does the panel's report suggest that from early 2022, Q1, that international visitors will be welcome back to New Zealand provided they meet all border requirements?
Well, this is a good opportunity for me to remind people that we give advice. We don't make the decisions. You know, someone, it was a very nice article in the Dominion yesterday by someone, it was very complimentary, but he said it was an odd committee because it was all scientists and doctors. Well, that would be an odd committee if it was going to make the political decisions. We're just giving one stream of advice. And I just, perhaps it's a good opportunity to say again, there are very difficult decisions here because we've got one group of New Zealanders who are really anxious to travel, to go off and unite with families or have holidays in Bali or whatever it is. There are also business people who need movements across the border for their livelihood. And living near Queenstown, you know, I hear from people there who are very upset. On the other hand, there's another large group of people who stand to lose next year when we have outbreaks. So that's got to be a political decision as to how to balance those objectives. And it's not an easy one. So I certainly can't answer that question. All I can say is that the view of our group is that once everyone's had a chance to be fully vaccinated, we should start the process. And we recommend that that should be in a staged, phased way, carefully monitored as we go along. And obviously, modifications would have to be made depending on our experience.
Any other comments on that one? No, nobody wants that one.
Yes.
The next question is maybe also not for the panel, but more for the people sitting in the front row, but I shall read it out anyway. Many community vaccination centres are operating well below maximum capacity. Why not open up larger age brackets or open all ages now? Do you want to say watch the space again, Ashley?
Watch this space very clearly. Look, what I would say is we are seeing the increase in capacity and the increase in interest and enthusiasm and uptake of the vaccine, and that's hugely encouraging. And I just want to acknowledge, it's an opportunity to acknowledge all those who have been working on this for many months, both within our ministry and across the system. And the really encouraging thing is to see how many people are taking up the offer and how many people are booking ahead for that. And so we are looking to get as many people vaccinated as quickly as possible. Now, one thing that is, and I'm sure you've heard this too, we set out to make sure that the vaccination experience was a really good one because we wanted people to come back for the second one, and all the feedback is that people are having a great experience. And so I just again want to acknowledge those who are doing so much hard work every day to deliver such a good experience.
Kia ora.
Can I make one comment?
Yes.
I think another good reason, if the government does decide to say yes early next year, is it's a reminder to everyone to get vaccinated this year. Because, you know, we all know we don't get round to things like filling out our tax returns and all the other jobs we have to do. I do it. Eventually. Sometimes I get a letter from the IRD. But yeah.
You're on television. You know, I think it's important for people to know the vaccines are going to be available when you're eligible, get it. Because early next year, we might be opening. We may hear today, I don't know. And gosh, if we start having outbreaks, people are going to be clamouring to get the vaccine. So why not do it now?
I just have one comment. I think I want to thank all the New Zealanders who are waiting patiently for their vaccine. I wish this vaccine rollout was much faster than it is, but I appreciate that I'm not in charge of it and I'm not in charge of the complicated logistics. But for those people who are waiting, I wanted to thank them. And I also wanted to acknowledge that there are lots of people dying to have this, you know, they are just beating down the doors. And so I think that's important to remember. And I also think it's important for us, everyone in this room, to thank those people who've already had their jab in the arm. We have to be grateful for every single New Zealander who does this, but remind ourselves that actually, in the ideal scenario, this vaccine rollout would be much faster than it currently is.
Can I add something? I know I'm not supposed to say something.
Go on.
The idea of opening up the vaccination to the wider community, and I think it's glad to see that Minister Alpito is here. Our communities haven't listened to the Minister of Health advice in the context that we've opened up the festival that Abi's talking about, and anyone who walks in gets the vaccination. Anyone who walks in, whether you are 65 or 25, the opportunity is there. And that's why we in the Pacific communities are continuing to improve.
I'll just wait. The reason we're not doing audience questions in general is so that people on the live stream can hear. So that was just a comment for the people on the live stream that Pacific communities also have a responsibility to step up.
My English wasn't too good.
It was good.
Yeah. No, so it's just you're not mic'd up. So that's great. Thank you. Another question that I've had a lot just out and about that's popped up as top of the list is how are people going to prove that they've been vaccinated for travel purposes? It's a really curly one. Any thoughts on that, Rob? You're nodding.
Yeah, I mean, I think proof of vaccination status is going to be critically important. It's critically important that people can carry that with them in an electronic verifiable form. I mean, personally for me, I don't think it's just about travelling overseas. I mean, I carry my picture of my driver's licence, my passport, everything on my phone. You just never know when you need it. I fully expect, and again, you know, I don't make policy, I fully expect there are going to be businesses and environments where you can't access unless you're vaccinated. We know that's going to be the case around the border, but I'm seeing increasingly overseas with businesses I'm associated with now, they're moving to make vaccination and vaccination status compulsory. And I think that will be the trend globally, and we'll have to in some way align with that.
Do you want to comment, Brian? How are we going to prove it?
Well, ultimately, a digital some form is, you know, the gold standard, but the work is well underway. And so that, as I said earlier, we have the opportunity while we prepare for the political decision to reopen, to do this groundwork and make the you know, to be authentic in this isn't just about us. It's if we want to roam around the world, our partners are going to expect it. So we're really incentivised to do it. But look, there will be a third market already, black market around the world, flogging off make-believe vaccination. So we have to be sort of pragmatic and grounded and have a standard that represents brand New Zealand, which is without question, when we assert something, it is sustainable.
The next one is a curly one. Can business help with MIQ capacity by taking responsibility for ensuring fully vaccinated, short-duration business travellers isolate safely at home on return? Thoughts on that?
Well, I mean, the MIQ constraints are causing a lot of anxiety at the moment within the business community, and you know, we focus a lot about people being able to come into New Zealand. Actually, it's becoming a big inhibitor to people being able to travel overseas for essential work. You know, I'm involved with a business now. We've got 3 people in the UK that just had to go for the survival of the business, have no idea at the moment how they're going to get home to their families. There's no easy way to suddenly just grow the capacity of the system that we have in place today. So I'm hopeful that we can look at alternative managed isolation solutions or isolation solutions. Obviously, isolation at home is one of those that has a lot of complications associated with it, but people are so desperate, they'll do whatever it takes, you know. And, you know, if I had to wear a ankle bracelet and, you know, I had to be in a place where no one else came and went from, and I had to get overseas, well, that would be fine. Now, that's not going to be fine for everyone, but it may take some pressure off the existing system if some people go through that pathway. So I think we have to be flexible to create solutions that will work for different cohorts and different groups of people. And business, I think, will be surprisingly flexible in terms of what they're prepared to put up with.
There's your headline right there, Rob Fife in ankle bracelet.
Yeah.
Brian, would you like to follow?
Yeah, look, I just the system will need to continue to innovate and experiment. We don't have a status quo system because we don't have a status quo sort of enemy in the virus. So, you know, those sorts of things that you're signalled are all on the work program. Once again, the theme has to be one of caution and being quite deliberate rather than maverick, because, you know, one moment of inattention eradicates all the value we've created. So I see all of that as just a natural evolution and innovation of the existing system.
Want to hear about vaccine boosters, which is another common question out and about. How's the government planning for next year and ongoing in terms of vaccine boosters? I'm looking at Ashley.
Yeah, we're all
You can't watch this space this time.
I'm happy for it. Maybe Michael wants to comment first about
Sure.
the evidence and where that might be going around boosters.
Yeah, well, look, we know with influenza you have boosters for two reasons. One is that you have waning immunity, and the other, of course, is that coverage of the emerging viruses becomes less complete. So that's why, and I think the two reasons will apply to COVID-19 as well, the benefits of boosters. Of course, the downside, and the World Health Organization is commenting on this, vaccines are a very limited resource globally. They're advising not to divert scarce vaccine away from low and middle income countries where it will be life-saving to boost vaccine effectiveness in high income countries. But of course, some countries like Israel are rolling out boosters now, and it's partly because they are a bit of a test bed for Pfizer vaccine, how it's working. And I think if we learn from that experience, that will be very useful. But again, I think this would be a resource we'd have to reserve, I think, for the most vulnerable if we decided to use it in New Zealand.
So perhaps just following on from that, we are of course in active conversations, particularly with Pfizer, which is the vaccine we've gone with to date, and wanting to keep open the option of access to booster doses in the case of either waning immunity or the need for a modified vaccine that addresses new variants. But also to keep open the option of being able to, if we don't need those vaccines here, that we will still be able to donate them to other countries that might need them if it transpires they're not required here. And we've got a track record already that's good of donating vaccine we don't need to other countries, and we will keep that as an option in our discussions.
Can I
If you
make
had a crystal
comment?
ball, sorry, Maya.
As an immunologist, I want to comment on this booster vaccine. I think it is incredibly important what Michael said, that you can have waning immunity, and you do sometimes have these escape virus variants where the current vaccine won't work to protect you. But at the heart of the problem we are facing right now is the new and emerging variants. And if we are good global citizens, we will not hog this vaccine for ourselves, but we will help to deliver the vaccine to these communities where these variants are evolving. So I think it's very important that people understand at some point we may need boosters. But certainly it is clear that the evidence for what they're doing in Israel I don't think is strong, that we don't yet have the scientific evidence to say that we should be boosting all of this Israel population, and we don't want to be one of the wealthier countries that does not support these poorer countries in terms of controlling this virus and keeping these variants from evolving.
So Maya, I was going to ask you, as an immunologist, if you had a crystal ball, wind forward 10 years, do you think we'll just have a COVID jab and a flu jab offered every year? Do you think we'll get to that state where we'll understand it well enough and it will just be routine?
It's interesting you should bring up a crystal ball, because I always say to my patients, I don't have a crystal ball. I absolutely don't have one. My feeling is that COVID is not going anywhere. Okay, that is clear to me, that it's not going anywhere soon. How we will vaccinate will be determined by what happens over the coming months and years. And that's where I think the scientific advice will guide us. But I don't have a crystal ball, and I'm not about to claim that I do.
But it could be an annual jab like flu, or it could be a 10-year jab like tetanus or something
I
like that.
guess for me, I try to separate the flu from COVID because they are different viruses. They behave differently. I think influenza is very good at morphing into a new thing every day. And in fact, COVID's not quite so good at that, the SARS-CoV-2 virus. So I try to separate those. I think that we don't know what the future holds, Juliet, but if we need to give vaccines together, we do that for other viruses. We definitely have vaccines where we can modify the vaccine so that it can target more than one virus. So I guess we just have to wait and see.
Michael.
I just want to add one more thing, and that is that in New Zealand, by eliminating transmission, we are being an incredibly good global citizen. We are not adding to the world's total of new variant viruses by doing this. It's not always appreciated, but this is a great contribution globally, and it's just unfortunate that more countries are not doing that.
Any last comments? So we're running out of time. We don't want to be late for the Prime Minister, but anyone want to make a final comment before we wrap up? If you're watching at home, what's the single thing you could do to speed this process up, I guess? Any last comments? David?
Get vaccinated.
Yeah. Yeah, it's all about vaccination, otherwise the other options are not credible.
Well, should we work along the panel?
Well, I mean, clearly it's about vaccination. I'm really drawn to Myra and Arpie's point, actually, which is about trying to figure out how we make the vaccine as accessible as possible to people right across all our communities, I think is the key.
Yeah, it's all been said, vaccinate. And also talk to the more reluctant people you know, explain the benefits. Also, they'll learn from your example.
Look, clearly the answer is vaccinate, but also the answer is to keep equity at the centre of what we decide to do.
And if you're still worried, ask a trusted source, someone that looks like you and speaks like you, and get vaccinated.
Do everything you can to help us keep the virus out of the country, including getting vaccinated.
So with that, can we thank our panel for all their wisdom and laughing? So it's now my pleasure to welcome the Prime Minister to the stage to respond to that discussion.
Kia ora koutou katoa, ngā mihi nui kia koutou, and can I begin by adding my thanks to Dame Dr Juliet Gerrard, whose advice and support throughout the challenges of COVID-19 have been absolutely invaluable. I also want to acknowledge Dr Verrall. You cannot imagine what it brings to the table to have an infectious diseases specialist sitting around the cabinet table with us. It's been an incredible addition to our team, and I wanted to acknowledge that. I also wanted to thank the panel. Not everyone we take advice from will agree necessarily with every single decision that we take, but you will see from the expertise that was in front of you today how important it has been for us to have advice that we can challenge, that can challenge us, and that eventually leads to the decisions that we then will share today and that you've seen across the course of this pandemic. I particularly want to start by thanking Professor Skegg and your group of experts, Nikki, I see you in the room as well today, for the important scientific contribution you've made to this discussion and the decisions that we have subsequently taken around the next steps for us. Right from the start of the COVID pandemic, the government's response has been underpinned by the best possible science, research and advice. It's an approach that served us well. We have amongst the lowest infection and death rates of anywhere in the world. Since the pandemic began, 1 in 1,675 New Zealanders have had a confirmed case of COVID, compared to 1 in 9 in the US or Sweden. And per capita, we have 2/3 fewer cases than, sadly, Australia. If New Zealand had been hit as hard as the UK or US, it's estimated nearly 10,000 Kiwis would have died. That's the population of Te Puke. And we were able to achieve this while having the least stringent restrictions in the OECD, resulting in unemployment recently falling to pre-COVID levels at 4%, and growth that has outperformed the likes of Australia, the United States, Canada, Japan, and the UK. But we would be wrong to assume that all science in the area of pandemic management is absolute and lends itself to a singular plan. It is not. With COVID, there is too much uncertainty, so every country has had to forge their own direction. In crafting a plan for New Zealand, we've very openly sought and received advice, had it contested publicly by other experts in the field, and ultimately made decisions that we believe have been in the best interests of New Zealand, both for our people and for our economy. And you can see that from the forum today, that continues to be our approach. Today, our goal is twofold. Firstly, to set out the evidence that is emerging as countries around the world grapple with Delta and the next phase of the pandemic. And secondly, to lay out the path ahead for the next 6 months. And that's what I'll endeavour to do now, using all of the evidence and advice you've heard. Just like the science, that path will not be absolute, but I think people have come to appreciate that while the future is uncertain and the plan can change, that doesn't mean we can't make one. In shaping that plan, you will have heard a strong theme in the evidence laid before us, the curveball that is variance. This is exemplified by Delta, and you can see on the slide in front of you countries who early on in their vaccination programs and who often we may have emulated or seen to be similar to, that have had transmission under control before Delta. I recall in a meeting recently Professor Skegg laying out the difference between Delta and the early iterations of COVID-19. And you can see that in the way it's behaved in Australia and beyond. Delta is a game changer in our risk calculation. It could be devastating if it took hold in New Zealand before we have high rates of vaccination. Evidence from China suggests that with the Delta variant, the time interval between when a person picks up the virus and when they become infectious themselves is significantly shorter. That is up to 3 times more infectious, meaning that one case is now on average passing it on to 9 others. What comes through in the evidence and what you'll have heard today is that Delta may be the variant of the day, but it may not necessarily be the only one. We all remember when the variant from the UK emerged, then Brazil. There will be more. The hope, of course, is that a vaccine will remain successful against whatever comes our way, but there are things we can do to make sure that no matter what happens in the short term, we retain as many options as possible as this pandemic continues to alter and change. That brings me to what it is about our approach thus far that has been the most beneficial to us. Our goal from the outset has been to save lives, and we did. We did so also believing that by reducing down as much as possible the impact on human health, we'd have the best possible chance of reducing the impact on our economy. And you can see some of the markers of that here today. That has proven to be true. Our economy has returned now to pre-COVID levels. Unemployment is incredibly low. We've outperformed most of the countries we compare ourselves to. And while there are ongoing challenges, we've largely avoided long periods of lockdown, having sick workers or many businesses being closed for good. While it has been extraordinarily hard, I am proud of what we achieved in the way in which government and business responded in this unprecedented challenge. That is not to say the response has been without cost. The impact of border closures has been very tough. It has impacted on loved ones, family and friends being separated, industries accessing skilled employment, or Kiwis just missing that personal sense of connection. It's just one of the reasons that I believe that this year has felt so hard. In 2020, we knew what we had to do. In 2021, we want to know that things will get back to normal eventually. And herein lies our competing challenges. How do we maintain the elements of our approach that have looked after people's health, made day-to-day life, for the most part, pretty normal, while reducing some of the friction at our border? To achieve that, it's the view of Cabinet that for the next period of the pandemic, that means maintaining our elimination or stamp it out strategy. While the pandemic continues to rage overseas and the virus continues to change and mutate, the best thing we can do is lock in the gains achieved to date while keeping our options open and giving ourselves choices. and a careful approach that says there won't be 0 cases, but when there is one in the community, we crush it, is the best way to maintain our normal lives while we monitor the twists and turns of COVID-19 over the next 6 months. One of the risks we all face currently is that in an environment where we have partially vaccinated populations, a variant that is more dangerous and vaccine resistant may well emerge, and you've heard that today. Now, we all hope that won't happen, but if we choose to change our strategy too early and we see an even more problematic version of COVID emerge, there is no going back. Ultimately, our response to COVID so far means we have more choices than many countries as we enter the next phase, and our plan needs to take account of that and our desire not to go backwards from where we are. So, principle number 1 will remain maintaining our elimination strategy to stamp out the virus so we can maintain our hard-won gains and keep our options open. That is not to say that the settings we have today will be the settings that we have forever. I've previously said that the border has acted like a collective armour for New Zealand, protecting us against the virus. The trick with vaccination is to move to each of us having individual armour, and meaning we need to rely less, or at least not only, on border settings. Vaccines are the game changer in this pandemic, but for them to be successful, we need as many people as possible to be vaccinated. When it comes to our vaccine rollout, we are now significantly ramping up as a result of having the access to supply that we needed in order to ramp up our program. The past few weeks have seen us reach important milestones with over 2 million doses delivered, and surveys shown that reluctance perhaps previously from some members of the population who may have needed more information, that is declining. We're now hitting around 45,000 vaccinations a day, just shy of our goal of 50,000 a day that we set for the September-October period, but with more and more vaccination sites starting up each day. In total, 848,406 people are now fully vaccinated. That's probably changed in the last hour or so, and a further 1,444,895 have had their first dose. And we're on track for everyone in New Zealand who wants a vaccine to be offered one by the end of the year. And we have an excellent vaccine. Pfizer consistently is leading the pack with very high rates of effectiveness. You recall that when we started our rollout, we were asked whether we would prioritise first doses and push out second doses, as some countries had done. We decided against that strategy. We wanted people to be fully vaccinated quickly, and for 2 reasons. The first was because those people we prioritised first were at the greatest risk. They were our border workers, our health workers, our older people. They were our first line of defence and those most at risk if the first line of defence failed. The second reason we decided against a spread dose strategy was because the clinical trials at that time were based on 21 days between doses. 3 things have changed since that decision. Number 1, we've rolled out the vaccination program to those most at risk. Number 2, a small number of studies over the past few months suggests a marginally greater immune response with a slightly longer delay between doses. And thirdly, Delta. Should we experience an outbreak, data shows that one shot of Pfizer can be as significant or is estimated to reduce hospitalisation by up to 71%. So as a population, we are safer if we have a larger amount of people at least partially vaccinated than we are if we have entire groups unvaccinated. The New South Wales outbreak highlights the risk of a Delta outbreak, and Professor Skegg's report is clear on the need to do all we can to keep it out. So while the first step in our plan to reopen our borders has always been achieving high rates of vaccination, we're now taking steps to speed that up. As such, we as a government have decided to accelerate the reach of our rollout by changing the booking system so that it will default to a 6-week gap between doses rather than 21 days. We also aren't requiring or asking or even suggesting that anyone currently booked in make a change to their second booking. This is about a change going forward for those who have not yet booked their vaccination. To be clear though, those who wish to have a shorter gap can still do so. And if someone is vulnerable, we still recommend being fully vaccinated as soon as possible. That's why there will be an option to have a shorter gap on the website when booking. But from a population basis, it makes sense to get as many New Zealanders at least partially vaccinated quickly. It's a small change, but with some win-win benefits. This change will make more booking capacity available, which means we'll be able to move through our age bands more quickly than previously signalled. As you know, those who are aged 50 plus will be invited to book from tomorrow, Friday the 13th of August. From there, we'll now be able to open up to a wider age band, inviting those aged 40 plus to book their vaccine next week, from Wednesday the 18th of August. And a week later, on Wednesday the 25th of August, we'll be opening up to those aged 30 and over. From 1 September, just a few weeks away, we will be open for all eligible ages. All going to plan, that should mean our entire population has had the opportunity to book a vaccination through September and their second one by December. That then is principle 2 of our strategy going forward, ensuring every eligible New Zealander is offered the opportunity to be vaccinated as soon as possible, because that is our best defence against Delta lockdowns and opens up a world of opportunity. And as you can see, our plan has us doing just that. Many have called for a definitive number or a percentage of the population that needs to be vaccinated before we start altering the phases we are in. Experts have advised against that. You've heard that from them today. We want as many people as possible to be vaccinated. But just as important is the fact that a single percentage doesn't tell us enough. I can share with you the markers, though, for good vaccine coverage that we will be looking for. 1, we're looking particularly to make sure we have good regional spread of vaccinations, so we don't have large pockets of unvaccinated people in parts of the country. 2, we also want to see high vaccination rates in high-risk populations. Older New Zealanders, immune compromised, those with comorbidities, to ensure the most vulnerable in the population are well protected. And yes, we will be looking explicitly at our reach into Māori and Pacific populations to ensure that we've enabled access to the vaccine in those communities too. 3, younger adults have been identified as strong sources of transmission, so uptake there matters, as does overall coverage across age groups, who tend to mingle with one another and can therefore be areas of weakness if we have large proportions that are unvaccinated. These will be the data points that we will be looking at. That then brings me to principle 3, reducing the need for further lockdowns as much as possible by continuing to strengthen our health and contact tracing systems. Vaccination gives us the best opportunity to do that, but the next 6 months will be critical. Not only do we need good vaccine uptake to break chains of transmission if they start, we also need to continue to be vigilant. And if a case does come in the meantime, we'll continue to take the short, sharp approach that has served us so well. As we flagged earlier this week, if it's Delta, that could well mean a short, sharp level 4 to prevent a long, drawn-out level 3. We must learn from the experience of others. But if everyone heeds the call to be vaccinated by the end of 2021, it is our goal to reduce and then eventually, as much as we're able, remove the need for lockdowns. Instead, we hope to be in a position to take what has sometimes been called and described here today, more of a measles approach to COVID-19. Many may have previously not known that the use of contact tracing and isolation is not new in New Zealand. Measles is both incredibly infectious but also potentially deadly for a young unvaccinated child. When we have outbreaks in New Zealand, we contact trace, we isolate. And these are the public health tools that in the absence of lockdowns, we will absolutely continue to use. And that means being prepared for that. So, principle 4, maintaining strong public health tools. But if we are to maintain a stamp it out strategy and we want to avoid lockdowns, that means trying to reduce how many cases we might need to deal with. And that brings me to our greatest challenge, the border. We cannot keep border restrictions on forever, and to be absolutely clear, we don't want to do that either, and neither do the experts we talk to. Border closures were only ever a temporary measure in order to keep COVID out before a vaccine was developed and administered. So long as the scientific evidence shows we can safely transition from a border defence to the individual armour of the vaccine, then that is the direction we will go. But once we are vaccinated, this will need to be a phased approach for two reasons. Firstly, while vaccination is ramping up locally, it is clear that the global vaccination effort will continue into 2022 and beyond. There will be large areas of the globe that will remain unvaccinated for some time, especially Africa, parts of Asia, South America, where vaccination rates are far behind those of the West. And we will continue to play our role in supporting vaccination through donation in those areas as much as we can. The second reason is that, as we all know all too well, a vaccinated person can still unfortunately pick up COVID. In Canada, for instance, they've started testing at their borders to try and reduce quarantine requirements. Of the 17,000 vaccinated Canadians coming through, 8 have had COVID. Now, that is a very small proportion, but if you think about it in terms of the previous level of visitors New Zealand had pre-COVID, that's the equivalent of every week 35 cases coming through our border, even if every single traveller was vaccinated. As Professor Skegg pointed out earlier, even if we had the same success as the UK with vaccination uptake, if we also adopted the rest of their settings, we could experience the equivalent of 48 deaths a week from COVID, nearly double the number we had in the entire pandemic today. That is not to say we'll keep our border settings as they are into the never never, but it is a good reason to be careful and not to move too soon and put at risk all the gains that we've made. Our plan instead is to follow the advice and keep our settings as they are while we vaccinate, but phase our reopening once we have good coverage in the new year. I don't propose that we sit back and wait, though. A phased reopening requires work, and that work has already started in two parts. First, how we're preparing to approach the border in the new year, and secondly, what tools and preparation we'll need to make this approach work. As a first step, from next year, once everyone who is eligible is offered a vaccine and we have good coverage through the criteria I just described, we'll move to a risk-based pathway system of travel. That means the nature of your entry into New Zealand will be dependent on a couple of key things, in particular your vaccination status and where you have been for the last 14 days. Countries will be grouped according to risk. Factors considered will be the number of cases, prevalence of variants of concern, vaccination rates, and our confidence in the country's strategies for maintaining outbreaks. We have started already with our approach to very high-risk countries, and we have a framework that we've established as part of that assessment, but this will be broadened. Alongside vaccination status, the risk of the country will play a big part in determining the pathway for arrival into New Zealand. We're already pretty well equipped to manage pathways 1 and 3. We've been doing these for a while and have the systems in place. But even for those pathways, there will be opportunities and priorities. Cabinet has agreed to prioritise the development of the Traveller Health Declaration System to confirm vaccination status and rapid border testing to increase our testing options. This reduces risk and makes it a lot easier for the traveller. On rapid testing, as per the advice from the advisory group chaired by Professor Skegg, we're setting up a COVID-19 testing technical advisory group to provide independent advice to the Director General of Health. Their focus will be on testing technologies, approaches and feasibility to make sure our work is even better informed by the latest and best developments in testing. On Travel Health Declaration, we're establishing a system to confirm a traveller's vaccination status. A digital tool is being developed by border agencies to help assess the level of risk of travellers to and from New Zealand. This is a Traveller Health Declaration system and will require travellers to upload information before they arrive in New Zealand, such as their vaccination information. This will be both for New Zealanders going overseas, as well as people coming into the country. In the short term, a manual solution will be developed to allow passengers to arrive in New Zealand when border settings are ready. In the future, this will be a fully digital platform that will simplify the traveller experience, and Health is already doing excellent work to lay the groundwork for this process. In addition, Customs, the Ministry of Health, Ministry of Transport and other government agencies are kicking off a new work program with airports and airlines over the next 8 weeks to develop options for how to support a safe and smart reopening of our air border, similar to the work they did together to prepare for quarantine-free travel with Australia. The group will focus on the pre-travel, en route, arrival and domestic stages of the overall travel and border process. The outcome will include information and options to inform government decisions on how the system might be operationalised in a way that is safe, streamlined, and as coordinated as possible. There is a wealth of knowledge and experience across government agencies and industry partners in the aviation sector. Bringing together this expertise will help inform government decisions on operational solutions for the next steps of our reopening. Pathway 2 will be new. It is our opportunity to change our border settings, freeing up space in MIQ, providing a way for more people to enter the country. Here, instead of 14 days of MIQ, we'll be looking at what we're broadly calling modified isolation. That means if you've been to a country where there is COVID, but pretty decent rates of vaccination, and you yourself are vaccinated, rather than going into MIQ in the standard way we do now, we'll be looking into either isolation at home and or shortened isolation periods. As you can see, there are a range of possibilities here, and to decide what they look like, we need more information, and we're starting to gather that now. As part of this, we'll be changing up the testing regime at MIQ so we collect a test at day 5. We're also going to start collecting data on vaccine status. This will help us to see whether those who are vaccinated and have COVID can accurately be picked up in a shorter window. If we get information that tells us that cases are coming through in that early period, that gives us extra confidence around reducing isolation periods in Q1 next year. Because vaccinated people also pose less risk, we want to consider the possibility of home-based isolation. So a lot of work is required to make this successful. Our public health advisors have told us that they definitely don't suggest we run this at a general level until next year, but we have proposed to them a tightly run pilot with vaccinated travellers only to prepare our systems. This will take place in October through December this year, and will take a limited number of participants to ensure it's done safely. And to give you a guide of what our view is on limited, we're talking hundreds, not thousands. This trial will enable us to test the logistics of entry into New Zealand under a self-quarantine model. The ability to monitor or enforce compliance. So for instance, whether or not a home D bracelet on Rob Fife is really the way to go, although by the sounds of it, maybe Professor Skeggs and IRD might want to explore these. And the management of COVID cases if they arise. This will be available to groups of people who meet a very tight set of criteria. New Zealand citizens and permanent residents who are fully vaccinated in New Zealand and have made a short trip away from New Zealand, travelling to an approved list of countries. They'll have to supply a self-quarantine plan as part of their application that meets the Ministry of Health's requirements. We'll confirm specific details of these trials in September, including establishing an expression of interest process. And it's our intention to work through employers who need employees to travel for work for this pilot. So as you can see, we will be tightly managing it. The reason for this is the extra assurance that having an employer involved with a bit of skin in the game will provide. So that sums up our 5th principle and our 3rd phase, to develop new ways to enable people to travel safely to and from New Zealand by progressively easing border restrictions, beginning in that first quarter of the new year with changes based on country of origin and vaccine status. Our ultimate goal is to get to quarantine-free travel for all vaccinated travellers. And what you can see from today is our direction and that our ambition is clear. And this sets out is a summary of all of the detail that we've shared with you today about our phases and what we'll be looking for in order to move through them. But simply, as you've heard from today, we're not in a position to fully reopen just yet. When we move, we will be careful and deliberate because we want to move with confidence and with as much certainty as is possible. Rushing could see us in the situation many other countries are finding themselves in, where after sustained periods of case numbers falling due to vaccination, they're finding them rise again after relaxing their settings and opening their borders. So our plan is to reopen in a phased way, where we assess and check before we take each step. While COVID keeps changing, we must keep changing too. But the work being done now puts us in the best possible position to use every tool we have to replace the 2 things that are causing the greatest challenges: lockdowns and quarantine at the border. I want to finish with a sentiment that Professor Skegg shared with me a little while back that's really stuck with me. He said, just after 9/11, the border will never be the same again after COVID. The point he was making was that things can change, but that doesn't mean we can't adapt to them in a way that eventually feels normal again. Vaccines, border testing, monitoring of symptoms when you travel will eventually become our baseline, and we will get used to it. Our goal as New Zealanders is to get to that place as quickly as we can with as little health and economic disruption as we can. Today, we've shared with you the first steps on the way to that plan. And my hope is next year, things will start to get just that bit easier, that bit more secure. Nō reira, tēnā koutou, tēnā koutou, tēnā tātou katoa.
Thank you, Prime Minister, and thank you everyone for your questions and engagement today. Shortly, we will have a closing karakia, after which everyone's invited to continue discussion over morning tea. And just to note that the media briefing with the PM and others will be in here, so if we could move out quite quickly, that will enable the PM and others to join us in the foyer as soon as possible. So I'd now like to invite Kura up to close today's forum. Nō reira, tēnā koutou, tēnā tātou katoa.
Tēnā koutou, tēnā tātou e wakarau ka mai nei. Karanga ki a ranginui e tūnei, karanga ki a pepe e tagato nei. Kia rarau ngā tapo ai a tangata e puta ngā ariki. Tēnei te hau kāriri, tēnei te hau kānguha. Tēnei te hau kātau mārire, tēnei te hau kā mahaki. Mahaki ki te rangi, mahaki ki te whenua, mahaki ki runga ki ngā tangata katoa. Turuturu o ti wakamaua kia tīnā, tīnā, huie, tāe kie. Kia ora koutou katoa.